All right, I'm going to get us started. Good evening. Welcome, everyone. My name is Logan Rockefeller Harris. I am the Director of Research at the North Carolina Budget and Tax Center, and we're really grateful that you've joined us for this evening's discussion of the federal funding chaos and what that means for North Carolina families and communities. The North Carolina Budget and Tax Center is proud to host this nonpartisan space to talk about the impacts of federal funding choices as part of our mission to make sure that every family and community, no matter where they live, where they come from, or who they are, have the freedom to thrive. And we know that that happens when we fund public institutions that are oriented towards anti-racist outcomes and informed by our collective experience. So we're here tonight to come together and make clear that federal funding is a really important part of the critical support that goes to families and communities. That includes everything from jobs to healthcare, food to housing, and that we know our state can't absorb the federal funding cuts that are already happening or being threatened through multiple channels right now. So we hope that by the end of this session, you will know more about the funding actions that federal leaders in the new administration and Congress have taken to date, have an understanding of how those cuts hurt all of us and our economy and our future, and that you'll take action to demand that federal and state policymakers make sure that everyone in North Carolina has what they need to thrive, and also share those opportunities for action with other people in your community. So tonight's agenda is pretty jam-packed. Thank you so much to all the panelists who've joined us. We have a lot of information and perspectives across almost every aspect of our lives in North Carolina. If during the presentation you have questions, you can type those into the Q&A box at the bottom of your screen, and we'll try to get to as many as we can during the call. We have some time held for Q&A at the end, and if we don't get to your question, we'll do our very best to follow up with you however we can afterwards. Before we jump in, we do want to hear from you. So we have two poll questions that we'd like you to share your thoughts on. So I'm going to turn things over to my colleague, Katerina Marroquin, our communications coordinator, to share those questions.
Thank you, Logan. So I'm going to launch some questions. So I believe it's all just one-on-ones. But anyways, the first question we have for you guys is, have federal funding decisions impacted you personally? Yes, no, or I don't know. I'm going to give you a minute to answer that. All right. I believe all of them were answered at the end, but we will share results as we go through the presentation. But for the second question, has your community been impacted by federal funding cuts to date? Yes, no, I don't know. All right. So for the first question, we see right now at least 25% of y'all have been personally impacted, or 30% say they don't know. And in your community, almost 80% have said yes. So at least 80% of y'all know somebody who have been impacted by federal funding cuts. But okay, thank you for sharing your perspective. Now I'll turn it over to Alexandra Savota, Executive Director at the North Carolina Budget and Tax Center, to share more about these federal budget cuts and how you can engage to make sure we have a budget that is well-rounded for the people. Turn to you, Alexandra.
Thanks, Katerina. Thank you, Logan. Thank you, everyone, for joining with us. It's not surprising to me that so many folks are already feeling the impacts in your communities of the federal funding decisions that are being made by the new administration and Congress. Federal funding matters tremendously to our communities. Federal funding provides the dollars that we need to make sure every child has access to a good quality education, that teachers are in the classroom, that people have access to health care and supports like food assistance and housing. And federal funding provides the dollars that keep people on the job at work in offices across our state, delivering critical services, guidance, information to families in every community in our state. Federal funding in North Carolina represents roughly the equivalent of the entire state budget. So when we start talking about reductions to federal funding, we need to start understanding what the scale is of the dollars that have come to our state and made possible so many things in our communities. These federal funding decisions matter deeply to the well-being in our community. And what we're faced with right now is what I refer to as a triple threat in the federal funding landscape. We have three things happening right now. One, the first is federal funding freezes. There are freezes on a number of federal funding grants and programs. These by freezing these funds, many folks in local government, nonprofit, state government are scrambling to figure out how to keep services running, projects moving ahead. The second threat is executive and administrative actions, primarily illegal actions to cut programs and staff in agencies across federal government. And these cuts are impacting people's livelihoods and having ripple effects through communities. And then the third and final threat in our federal funding landscape are the congressional budget resolutions. There have been two budget resolutions passed, one by the US Senate, one by the US House. There are currently negotiations underway between the House and the Senate to come up with a single budget resolution that would be passed through a reconciliation process. And these budget plans identify deep cuts in programs and services like healthcare, food assistance, and more. Those cuts are necessary because the priority by Congress has been placed on cutting taxes for the ultra wealthy in our country. So what happens when these federal funding actions roll out? They may be coming through different channels, but they all have the same impacts in North Carolina. They'll do three main things. First, they'll shift the costs to the North Carolina state budget, reducing the federal funding that's available for many critical services and programs in our communities. Second, they will hurt people, our neighbors, our family members, our communities. And third, they will block progress on some of the key goals we have as a state and as a country. Progress on goals like making sure our air and our water is clean, that every community has the infrastructure to connect to the internet and basic utilities. So these federal funding actions have the same impacts. And I want to dig a little bit deeper into each of them. Right now, what we know is that the cost shift of these federal funding actions to North Carolina's budget is simply unsustainable. The cuts being proposed at the federal level to programs being considered like programs like Medicaid would shift costs by creating potentially a block grant or putting a cap on the federal funding that would be provided for specific services, or alternately reducing the federal cost share. On the food assistance side, there are proposals to require states for the first time ever to pay for the cost of food assistance. And then there are other cost shifts. Discussions of whether disaster recovery funding should shift from the responsibility of FEMA to states. These cost shifts, again, are unsustainable at a time when North Carolina knows that we have already a problem with meeting existing needs because of tax cuts at the state level. A cost shift from the federal government would be impossible to meet or minimize the harm of. And so people will be hurt by these federal funding cuts. We know that there are more than 600,000 who have received health care coverage because of Medicaid expansion. More than 1.4 million households have food on the table with the help of food assistance. More than 84,000 federal employees live in North Carolina, and many more jobs are supported by federal grants and contracts. Finally, as I said, these federal funding cuts will block our progress on key goals we have for our state, goals that have been a priority of North Carolinians time and time again. Priorities like making sure families can afford the basics, making sure that we're protecting the health and well-being of people, and making sure that every community is resilient in the face of disaster. The reason that these cuts are being pursued is because there's a overall goal of shrinking the size of government to extend tax cuts for the ultra wealthy. These tax cuts grow the deficit, grow inequality, have proven a failure in boosting employment and lowering costs for everyday working families, and they consolidate the power that already exists among the powerful in our country. This is just one brief snapshot of what's the extension of tax cuts that are being considered this year and would be financed with the cuts that are being proposed to the budget. You can see here the top 1% receive more than $60,000 a year in from the tax law that is considering they're considering extending this year. But it's also important to look at what this means in terms of the share of income. And here again, you can see just how upside down these tax cuts are, benefiting the ultra wealthy and doing very little for everyday people across our country. One thing that we know is often talked about is that these tax cuts are good for the economy. Anything that would not deliver a boost to middle income people, and that would do so by taking away healthcare, food assistance, housing, is not good for our economy. We know that people fuel our economy. They make it run through their work, through their care, through their connection and shopping in local communities. But the tax cuts that the Trump tax law included, including the corporate rate cuts, didn't boost most workers' earnings and instead went to very highly compensated executives. So again, what we have here is a choice between the programs and services that deliver opportunity in communities across North Carolina and extending tax cuts for the ultra wealthy that primarily benefit the ultra wealthy and put at risk our future by extending the costs to our communities. I'll just close before I turn it to my colleagues and partners who are working on so many important aspects of the current federal funding landscape to share a little bit more about the biggest threat that we are following in at the Budget and Tax Center, and that threat is the congressional budget resolutions. Again, we know that all of these approaches, from the funding freeze to the illegal actions to cut programs and funding that's already been appropriated, all have a negative impact. But the congressional budget resolutions propose deep cuts in programs like Medicaid, SNAP, student loans, energy resiliency, in order to both pay for a deportation machine, expanded deportation efforts, and on the House side, to pay for the expiring Trump tax cuts. On the House side, the budget resolution, the cuts being proposed are roughly equivalent to the $1.1 trillion in tax cuts that would go primarily to the top 1%. These budget resolutions, we should all be clear, are very unpopular Congressional members have been intentionally trying to hide the cuts through this process that they're using, claiming that these cuts are not funding the tax cuts, but these cuts will impact people's access to critical supports like healthcare, food assistance, and more. And what will happen is that state legislators will be left to deal with the impact. So as we turn now to hear from some of our partners who are experiencing different aspects of this federal funding chaos and cuts, I just wanted to say that I'm incredibly grateful to be in partnership with these folks from across the state, and really grateful that they're here tonight on short notice to share with you what they're seeing, what they're experiencing. So with that, I'll turn it first to Liz Clausen-Kelly, Chief Executive with Roof Above, to talk a little bit about the impact of the federal funding freeze. Liz?
Yes, thank you so much for raising this issue and giving me a chance to share a bit about the work of Roof Above. For those who don't know the work of Roof Above, we're located in Charlotte, North Carolina, and we're actually North Carolina's most comprehensive homeless service provider. We started very much just an emergency shelter and meeting people's basic needs, but we've come to understand housing's the solution to homelessness. So actually, today, the bulk of our work happens through offering supportive housing for a very vulnerable subset of folks, often folks who have a disabling condition, often more than one, and have experienced long-term homelessness. That's the bulk of our housing work. And we have developed in such a way that we really braid together local funds, federal funds, and private funds. And so federal funding, even if it might come through the city or the state, at the core, federal funding makes up about 25% of our $21 million budget. And so while it's difficult to get clear information on exactly what are we anticipating, we're really looking at that whole picture of how that 25% of federal funding makes our work happen, and what's then at stake if some or all of that goes away. And so I'll just speak briefly and to talk really about three impacts. And so first and foremost, the threat of losing any federal funding is a direct threat to vulnerable people's housing. And so when you look at all the different things federal funding goes towards in our work, sometimes it's emergency shelter, sometimes supportive services, but the bulk of it is really rent. So it's rent subsidies to take these rising rents that are all around us. Charlotte's a prosperous city, it's growing, rents are rising. So subsidy is a way to keep those housing units affordable to people on very limited incomes. And so if this funding is at threat, it's a direct threat to, in the case of Roof Above, hundreds of people that we provide housing to every day. It's also a threat to nonprofits. I mean, even this time of uncertainty, for example, we have a federal grant that's due to renew in just a few weeks. And it's not uncommon that the federal government is maybe not super punctual on renewing grants, but what's very different this year is we just have this lack of clarity. Is it going to renew? What does that mean for our actions now? So we're really trying to both respond to the emergencies of homelessness, to work with urgency, but also recognize financially if the future funding isn't certain, what decisions do we need to be making now? And so there's just concerns, I think, around the financial health of our nonprofit with a lack of clarity of the certainty of that federal funding. But then I think the other piece that maybe folks don't recognize is homelessness. While it's, foremost an issue that impacts those in a housing crisis, it really impacts an overall community. And if you've lived in places that have large encampments, the impacts of those encampments on businesses and other residents. So just one data point to share, when Roof Above started our supportive housing work more than a decade ago, we had a chance to work with UNCC to do a study, and we looked at people before and after, 2 years before and after they moved into our supportive housing program. It's a program called More Place. And just a couple data points from that study. So we followed 50 of our tenants, again, looking at them what happened 2 years before they moved in and 2 years after. And what we saw is that there was an 81% reduction in emergency room visits after folks moved in versus before folks moved in. There was a 62% reduction in hospitalization. So people were much less likely post-housing to be hospitalized. And together that meant a overall hospital bill decrease by $2.4 million for those 50 people, comparing before and after, 2 years before and after housing. And so I say all that to say when people are very vulnerable, they often interact and engage with the system in ways that are more costly and less life-giving for them. And we know by investing in things like supportive housing, that benefits not just those individuals, but our overall communities. So we find that we have a wide variety of supporters because people understand when we work together to solve homelessness, it benefits the overall community. So that's just sharing a little bit from our vantage point tonight. So thank you for having me.
Thank you so much, Liz. Very powerful to hear about the work that you're doing. Thank you for all you're doing in this difficult environment. I wanted to turn it to Matt with Carolina Farm Stewardship Association to share more about the impacts of recent decisions by USDA on the efforts that are already underway to strengthen farmers and local food systems.
Thank you so much. Well, yeah, my name is Matt Neese. I am the Policy Director for Carolina Farm Stewardship Association. For those that aren't familiar with our group, we're a two-state nonprofit. We cover both North and South Carolina, and we are a resource hub that provides both technical assistance as well as advocacy opportunities for small and mid-sized growers and producers throughout the Carolinas, as well as the food systems that they sell to. So market access has consistently been an issue. I should say reliable market access has been a consistent issue for local and small scale growers. So we're trying to make sure both sides of that equation have been supported. So we do that with a combination of on-farm technical assistance, whether it's helping farms with organic transition plans, with food safety preparations, helping them get GAP certified, things like that, as well as high tunnel consulting, research, farmers in training, new and beginning farmers, things like that. And then from the advocacy side, we also help enable and be the voice of small and mid-scale growers and producers in the halls of government. And that's everywhere from the local level at the Board of Zoning Appeals all the way up to the halls of Congress in Washington. So we actually flew a few farmers up the second to last week of February to meet with the Carolina congressional delegation and raise some of the issues that are going on. And so it's, most of our farmers are too busy farming to make the drive to Raleigh or to Columbia or to Washington. So that's where we like to step in and really diagnose the policy issues that are facing them. So in terms of the impacts that we're seeing now, it's really hard to overstate the impact that the federal funding freeze and the recent executive actions have had on food systems in not just North, but also South Carolina. And one thing that I'd like to highlight is kind of the nature of the problem, as the previous speakers have pointed out. It doesn't just affect the organizations that are representing individuals and farmers. They're actually impacting the farmers themselves. So groups like CFSA, we're still waiting on, several $100,000 in accounts receivable for local food system partnerships, for farmers market promotion programs, for work that's been completed not just this year, but also in 2024, that we're not getting a lot of communication on from USDA. But even beyond CFSA, the impacts that we're seeing on individual farmers and food systems are hard to overstate. So typically the way it's gone is farmers, ranchers, foresters, they've been signing up to receive funds by entering into contracts with the USDA. And that's on everything from conservation efforts on working lands for soil health, for water quality, for renewable energy, for local food procurement. And these programs provide reimbursements where the farmers take on the initial expense of any type of contracted project with the expectation, the reasonable expectation, I'll say, that USDA will promptly reimburse them for any costs they incur. What we've been seeing is that with the funding freeze that's still in place, that's not been happening. A lot of the projects are more than a year or more underway. Farmers and ranchers have spent 5, sometimes 6 figures out of pocket for infrastructure improvements, for investments, for market access, trusting that USDA would hold up their end of a legally binding agreement. And for the last 4 weeks, they've not been. We've got hundreds of farmers throughout the Carolinas that have been left holding the bill for work that they were legally promised they wouldn't have to do. And they functionally have been left in the wind in terms of planning growing seasons, in terms of planning budgets for the rest of the year, because it's not just that they're being denied the money, it's they're being denied communication on when, if, or how much of this money they're going to receive. So they're not able to make adjustments in that way either. In terms of where we are, things have been changing, and I'm sure this has been the case for everybody, not just day to day, but hour to hour. So it's been very hard to paint kind of a clear, up-to-the-minute picture on where things stand right now, but I'm going to try my best to do that for you right now. Basically, any funding that's been touched by the Inflation Reduction Act remains paused. We've got anything from programs like Rural Energy for America, which incentivizes renewable energy on farms. That's still frozen. Anything associated with conservation technical assistance, the CTA program, that appears to be paused. In the last week to 10 days, we've started to see some movement on conservation funds. So farmers who have EQIP, which is Environmental Quality Incentive Program, or CSP, which is the Conservation Stewardship Program, those contracts appear to be starting to move, but it's all anecdotal. Nothing from USDA has confirmed or denied this. On a bigger scale, many of you have probably seen, it's been making national news, the disruptions in the Local Food Purchase Assistance Program, which was a local food procurement in all 50 states. And it's designed to purchase food at fair prices from local farmers. Food hubs and associated groups will package it up into food boxes and then distribute it for free to hungry communities and communities in need. While existing reimbursements are being processed, the new tranche of $500 million for the continuation of the program was effectively terminated. That is what has been funding Farm Share, which is on this slide right now. We're currently working in the North Carolina General Assembly to try to procure state funds as soon as humanly possible to continue the program. But in addition to LFPA, we've also the Local Food for Schools program, which has been driving local produce into local school districts. That's been terminated. And then even beyond just the terminations and the funding freeze, we're seeing massive layoffs of all the executive agencies in Washington. Last I saw, USDA has had, I believe, the second most number of layoffs of any federal agency right now. It's cleared 5,000. I know there have been court orders to reinstate those individuals. Whether that's happening or not has not been communicated. So even if your grants have not been frozen or terminated, there's hardly anybody at USDA right now to answer the phone or reply to your emails. So it's, again, not to sound like a broken record, but this is really unprecedented in terms of the impact on farmers. We've had some success in terms of outreach and advocacy to elected officials, stressing that, forget nonprofits, the individual farmers are continuing to be hit by this. And we've gotten, I'll say, a semi-sympathetic audience. A lot of elected officials have wanted to know specific instances, and they've tried to triage it one case at a time, which is exhausting, frankly. They need to fix this at the federal level. And then there have been some representatives and senators whose staff has outright told us that farmers are just going to have to be collateral damage, and that if they're relying on federal funds, they probably weren't viable as a business model. And it's just this kind of like callous, capricious approach to fixing the problem. So it's continuing to unfold. Again, things are changing day to day, hour to hour. And so we're doing our best, along with our other friends and partners in North Carolina, to stand in the gap and be the voice of farmers and be the voice of small food system businesses to get the money not just that's due to them for work completed, but also money that's going to continue to build the local and regional food systems that we'll need going forward. So that's my update, and I'll answer any questions in the chat.
Thank you so much, Matt. Thank you for all you're doing. I know it's a tremendous amount of work and really disheartening to hear that last statement of approach to what farmers are facing. We know that having resilient food systems is such a critical part of living a good life and being well and having communities that are well. So I'm grateful to have you on to share your perspective. I'd love to turn it now to Heather Hughes, who is the president of the AFGE, Association of Federal Government Employees, Local 3509. Very excited to have you with us, Heather. Thank you for joining us to share more about what you're experiencing and your members are experiencing.
Thank you. Well, first of all, I work for Social Security, but I need to make it very clear that I'm not speaking on behalf of Social Security tonight. I'm speaking on behalf of the American Federation of Government Employees, AFGE, my union, and of course, just on behalf of, my opinions, my sole opinions. We are the union that represents most federal employees, but my particular local represents all Social Security field offices in North Carolina, and there are 38 of those if you count our work support unit, which is not a public office, but it's an office that handles internet claims for benefits. So everybody knows about Social Security. Everybody knows that it's a hot topic and that nobody wants it to go away. But I want to educate everybody tonight on some things that you probably don't know about Social Security. And make one thing very clear. Regardless of what is being said, the intention of the cuts to Social Security and to the staff of Social Security is to break it so that it will not be able to function, and then it will have to go to the private sector. Whatever retirement plans anybody has will have to go to the private sector. So even though Congress and DOJ are saying we don't intend to cut Social Security or cut Medicare, they're very careful with their wording because they don't have to make any cuts if they just break the system completely and it just goes away. They didn't actually cut it, right? It went away and they had to come in and offer something from the private sector. So Social Security, most people, when they think of Social Security, they just think of, well, I've worked and one day I'm going to retire and collect my Social Security. But there's so many other things that the Social Security Administration is a part of, and particularly with we work very closely with the state government. And how we do that is with the other program that we administer, which is SSI, which is the Supplemental Security Income. That is our program that is for the aged and the disabled who are under certain income and resource limits. So basically, it's a welfare program for the aged and the disabled, and it also covers disabled children, which, as you know, Social Security, you're not eligible for it unless you've paid in through your payroll taxes, or if you have a surviving or dependent child or spouse that can collect if. But SSI in North Carolina, now these figures that I've got are about a year and a half old because I couldn't get anything more current. But as of 2023, we had 215,000 SSI recipients in North Carolina. And that accounts for almost $150 million in payments, in SSI payments per month. Now, the other thing that SSI is involved with is Medicaid, because in the state of North Carolina, we have an agreement with the state that if someone is eligible for SSI for even $1 in benefits, they're also automatically eligible for Medicaid. So that relieves the state from the burden of having to make these, take these claims for Medicaid and continue to recertify these recipients for Medicaid, because it's automatic and we're handling it. So what happens if well, before I even say that, Social Security has been it's been weakened. The agency has been weakened for years now because Congress has not given the agency enough budget to continue to properly administer the program. We are at a more than 50-year low in staffing at a time when, we all hear about the baby boomers are now coming, well, not now, they've been now for several years coming to retirement age, but also the population is just growing. So as everything grows that we, that we have a part of making sure, people can get their Social Security check or their SSI check, our staff continues to dwindle. And then we've just, they've just fired a lot of management in Social Security, and they've offered these buyouts and these early retirements and all of these incentives, and they're trying to reduce our staff by another 7,000. And that's why I said, Social Security can't afford to lose one more person, much less 7,000 more people. We already can barely function. When you go to a Social Security office and you have to wait hours, or when you call the Social Security Administration and you have to wait on the phone for hours, or it eventually just disconnects because you've been waiting so long, it's not because the employees are lazy and they're not doing anything. It's because the employees are not there anymore. We have already been losing staff tremendously, and now we've lost even more. So what happens if the Social Security Administration goes away? There's nothing waiting in the wings. So sure, if you happen to be somebody who's a little more affluent, or you had a more, higher paying job, then you might be able to go to, a private retirement fund, something like that. And hopefully, it's not tied to the stock market and you lose it all. But what happens to all the people that are dependent on the SSI? And who's going to take that over? Well, it's also, most people don't know that SSI even exists. It's only 50 years old. But it exists because there was a concern in the 60s of the burden of states on their vulnerable population, the population that they needed to assist with the welfare type programs, and that some states had more resources to do that than others. And there were great migrations of people from one state to another because that state offered, much better welfare programs. So the federal government took it over, and that was SSI. So if SSI goes away, then the burden's going to go back on the states. So at the beginning of this, one of the slides we had said that North Carolina receives $35.4 billion, or it did in 2024, in federal grants. But add to that, if Social Security goes away and there's nobody administering an SSI program anymore, add to that the $147 million a month in SSI payments that would go away, and the states would, people would look to the state to take that on. But also, as I said, the burden of the state to administer the Medicaid program, that Social Security relieves the state of that burden. And it's just untenable. It's not doable. So we need to be letting our congressmen know that any further cuts are going to destroy Social Security, and we cannot do without Social Security. Can it be made more efficient? Can they, give us better computer systems? Yeah, absolutely. Those are the kinds of things we need. We don't need to just be, slashing 7,000 more employees when we already have way, way, way too few anyway. That's pretty much all I had to say about that. Thank you.
Thank you so much, Heather. Really important message about the powerful role that federal employees play in Social Security and more broadly too, as people in their community spending. Really excited to invite Kate Hansen, Executive Director of Meals for Families, to share her perspective of what the federal funding landscape means for families in North Carolina being able to keep food on the table. Kate?
Thanks so much, Alexandra. Really honored to be here with wonderful co-panelists. And all of you, I see some familiar names and faces in the participant list, so glad to be here. Also want to recognize that a lot of you here tonight probably have personal or professional experiences with SNAP. So if you want to share some of that in the form of a question or in the discussion, really happen to learn with you and from you too. So yes, Meals for Families, I would start just by introducing myself and our work. We are a relatively new entity in North Carolina. We are a pandemic baby of an organization. And I mention that really to say that, we're coming into this space in a really rich landscape of others out there working to support families and end hunger in North Carolina. And so when we came into this work relatively recently, we really wanted to be intentional and say, where's their opportunity? Where can we step in and help move the ball forward? And so when we were developing the very seeds of Meals for Families, from really the very first moments, we had almost a laser focus on federal programs like SNAP and WIC and school meals. And because we really, as we looked around and learned and listened, we really came to see, again, pretty early on, that there was so much consensus that these federal programs were the most powerful tools that we have for ending child hunger. So as Meals for Families, that really is our mission. How can we not just reduce, but end child hunger in our state? And we're absolutely not going to be able to end child hunger or reduce child hunger without these federal programs. So without SNAP, without WIC, without school meals, and without tax credits for families. So really, we have made it our work over the past 5 years or so to expand access to connect North Carolina families with federal dollars through public benefits and tax credits. And it's been wonderful to work very closely with the budget and tax team and others on some of that tax credit access work. So yeah, when we think about those programs, another thing I want to point out is that we may have some food bank partners in the audience here, but it's a very broad consensus that these federal programs, again, are the most powerful tools we have for reducing and potentially ending child hunger. Because hunger in the United States, and particularly child hunger, it's not just a fact of life. It's not just a natural phenomenon. The fact that we have child hunger in our state or in our country, that is a policy decision that we have made together. And we also know how we can make policy choices and implement and expand programs to end hunger and end child hunger. And I think it's important to note that our partners who work in this space but focus more on maybe direct food service and charitable food service will also be some of the loudest voices standing side by side and saying, yes, we need these federal programs. We are not going to reduce child hunger or end child hunger with charitable giving alone. There is just no way. The dollars are not there. And I want to get back. I know I saw Jeremiah ask a question about how do some of these federal changes affect food bank partners? Well, at the very same time that you have threats and potential threats to the federal programs like SNAP and WIC, you also have food banks losing money. So we have food bank partners across North Carolina have lost $11 million because of federal cuts. And I saw the Food Bank of Central and Eastern North Carolina share with WUNC recently that for them, that means a $2 million loss right there. So at the same time that we have threats to some of these federal programs, we also have cuts being made that affect our food bank partners and the important work that they do. Another thing I want to say is that, you don't have to take my word for it, that these are the most powerful tools we have for ending child hunger, because our health partners and our health leaders recognize this as well. So when you ask the American Academy of Pediatrics, what can pediatricians do to support a family that's food insecure or facing hunger, they say, help connect that family to SNAP and WIC. And the Center for Disease Control, wouldn't you know, thinks about child welfare and child abuse. And they say, guess what? Connecting families with tax credits is an evidenced way to reduce child welfare interactions. So these dollars really make a difference in families' lives. And I guess I have just a couple minutes left. I want to share with you a few takeaways. One thing, if you look at the lighter blue box on this slide here, if you wanted to be just very cynical about this, you can also think about SNAP as an entity that brings billions of dollars in purchasing power to North Carolina. So even if you didn't care about families, you might care about SNAP as a real economic driver and economic engine supporting our local economies. But of course, we do care about families. So just to leave with a couple of thoughts about who are the people and who are the families behind these numbers. So who is it that is supported by SNAP in North Carolina right now? It's by and large families and children, families with children. So if we look, again, I know Alexandra and team shared at the beginning of this presentation that in 2024, SNAP helped more than 1.4 million people in North Carolina. And when you look at those participants, almost 70% of those SNAP participants are families with children. More than 30% of those SNAP participants are families who have an older adult or someone who's disabled in their household. And so by and large, SNAP participants are families with children, and they're also working families. So more than 45% of SNAP participants are in working families. And if you look at the occupations that are typically represented among SNAP participants, we see almost like 30% of cashiers in our state are supported by SNAP. Same thing, almost 30% of home health aides are supported by SNAP. So any cuts to this program would affect hundreds of thousands of people across our state, both through the direct cuts to benefit levels or rolling back of benefit levels. And also, again, I think to mirror what Heather was saying, we would also feel impacts with reductions to our state workforce and the support that the Department of Health and Human Services receives to administer these programs. So I will wrap it up there, but I also want to note, if we have time, this is just one example of a cut to one program, SNAP, but we have not just SNAP being threatened, but also WIC, another incredibly important program that supports women and infants and young children. And we also have proposed cuts to school meal funding. So really we're seeing threats being made across the board to a lot of the programs that put food on the table for the families and kids in our state every day. So I'll leave it there and pass it back to you, Alexandra. Thank you so much.
Thanks so much, Kate. It's sobering, but I really appreciated your point about it being a policy choice, and that we can make some pretty significant progress on issues that we all care deeply about. Making sure every child has food is something I think we can all agree should be a top priority. Thank you so much. I'm excited now to turn it to Rebecca Cerise with the Health Advocacy Project of the North Carolina Justice Center to talk about how federal funding chaos risks healthcare for North Carolinians and the tremendous work that's happened to ensure healthcare for North Carolinians. So Rebecca, thank you so much for being with us.
Thank you. Thanks, Alexander, for the invite. So nice to see everyone on the call. Just so much engagement just in the past few weeks, and it just really gives me a lot of hope that we are up for this fight, and it's certainly going to be a fight. So again, I'm Rebecca Cerise. I'm the health policy advocate at the Justice Center, yeah, there's a lot of different ways that these federal cuts are going to impact healthcare. Before I get to Medicaid, just want to talk about the cuts to the workforce at the VA, which are going to be horrible, already under-resourced and understaffed. And then, of course, the federal cuts to funding for groundbreaking research, medical research that's out there, which also has a huge impact on North Carolina because we are the home to a lot of really incredible, important research into fighting diseases, fighting conditions, and things like that. So just on that level, those cuts are going to be awful. In terms of the budget resolution, like what Alexander was saying, unfortunately, it appears that Medicaid, which is jointly administered by the and financed by the state government and the federal government, is under attack. What is Medicaid? Medicaid is a very far-reaching comprehensive health care program that offers comprehensive health coverage, including things like dental and hearing and vision, mental health, substance use disorder, to people in our state with the lowest incomes. We have over 3 million people in North Carolina that are getting some type of Medicaid assistance, including 1.2 million children, but it's also seniors, either who are dually eligible for Medicare and Medicaid, or like my mom, who actually gets a Medicaid assistance to help pay for her Part B Medicare premium, which is $180 a month that is not taken out of her Social Security check, which she really, really needs being on a fixed income. Then you also have people with disabilities that rely on Medicaid. Many of the births in North Carolina are paid for by Medicaid. Seniors in long-term care, more than half of them are paid for by Medicaid. And then, of course, we have these 630,000 North Carolinians that just in the last little bit over a year have gotten life-changing, life-saving health coverage through the Medicaid expansion program. And that is one reason why I think there is cause for cautious optimism, but at the very least, we have a unique perspective here in North Carolina, because Medicaid expansion, even though it took 10 years, was passed in a bipartisan way through the legislature. So there is broad bipartisan support for Medicaid in this state. And I think that that gives us an advantage when we are actually trying to, push for it, advocate for it on the federal level. That other states might not have, because we really can point to it as being a bipartisan effort that has been a lifeline for not just people in North Carolina, particularly in rural areas, but also for our hospitals, again, in particular, our rural hospitals. That's another way that Medicaid, we have a very, by the way, we have a very cutting edge Medicaid program in North Carolina. We have something called the Healthy Opportunities Pilot, which is also paid for with Medicaid funds. And that is it's just a pilot program now, but it's set to be expanded statewide, which looks at social drivers of health, like food, transportation, housing, and toxic stress. And interpersonal violence. Really, really great. We also have, so part of our Medicaid expansion law also has something called state-directed payments in North Carolina. They're known as HASP. And that is basically reimbursements that are enhanced, reimbursements to hospitals for taking Medicaid patients. And that's bringing in this year about $6 billion to our hospitals. So besides patients, the institutions that will be hardest hit by Medicaid cuts are absolutely our hospitals, because they see by far the most Medicaid patients, and they're also getting these state-directed payments through the Medicaid program. There are a couple different ways that they're looking at cutting Medicaid or changing the way it is financed, which will equate to a cut. And Alexandra talked about a couple of them, something called per capita caps, which is they're going to limit per person how much money Medicaid at the federal level will pay for someone, which means that would then go onto the state budget. Block grants is another. And so block grants is they look at the entirety of the Medicaid program and then just give a set amount of money for the entire program. Again, that will lead to undue burden on our state budgets, and which will mean cuts to services and potentially eligibility and some programs going away. Like I mentioned, Medicaid is jointly administered and financed by the state and the federal government. And for the traditional Medicaid population, it covers around 65 to 67% of the match. It's called an FMAP, or the federal match. There's also talk about cutting the federal match down. Even a small percentage of the federal match going down can be tens of millions of dollars. So that would also, once again, put the stress on the state budget. The most egregious and scariest of the cuts is a cut to the 90% match that the federal government guarantees for the Medicaid expansion population. We have something in our law, our Medicaid expansion law, that is a trigger that says if we go below that 90% match, that the Medicaid expansion program ceases to exist. I will say this week I have had two meetings, the last 2 weeks, two meetings with two of our congressional representatives. One was actually with Representative Greg Murphy himself. And although that meeting did not go amazingly well, one thing that he did say was that no one, in his words, is looking to cut the 90% match. I don't know if that's true, but it was very good to hear him say that piece out loud on a call. He said it would be catastrophic because we're not the only state that has a trigger law, and that would just throw so many people off. And again, like I said, that had bipartisan support. And so that is going to be a much harder thing, hopefully. I heard the same from Senator Tom Tillis's staffer just today. We were on a call with them. By the way, I have to say, it went extremely well. And it seems, at least right now, that Tillis could potentially be an ally in this particular fight. I'm not saying other fights, but in this particular fight, he said hard no on on any touch to the 90% match. His staffer said, and they also said a hard no on block grants, which was really heartening to see. And to hear. Again, whether or not they will actually live up to that, I don't know, but he seemed to have a really deep understanding of the program and really was really engaged in the conversation. We are, oh, and I forgot, there's one other thing, which is the work requirements. That's another thing that they're looking at. Work requirements are completely unnecessary and a waste of money. The majority of people on Medicaid already are working, usually in low-wage jobs that don't offer benefits. And the people that aren't working are not working for real legitimate reasons. They're caretaking for their family members. They are disabled in some way. They are unhoused and having a hard time, finding a job, or they are just re-entering from society from incarceration and don't have a lot of opportunities for employment right off the bat. We talked about all those things, and also they cost more to administer than they would ever save the program, and they wrap people up with red tape. So I made all of those arguments today on the call, which was fantastic. And really important. So Tillis is someone that I would suggest people call, do it in a way that's polite and kind, and really encourage him to be a champion for Medicaid, since that is the messages that we are getting from that office right now. Really important. Another congressperson that is important that we reach out to is Richard Hudson. Richard Hudson is the only representative in North Carolina that is actually on the Energy and Commerce Committee in the House, which is the committee that is going to be looking at ways to cut the Medicaid program, like Alexandra said at the beginning of the call. I will finish by saying we have just finished putting together a collaborative storybook that has almost 100 stories in it from people across North Carolina that have had their lives positively impacted by Medicaid across the board, not just expansion. And then we also have worked with medical students and other medical and healthcare professionals to do a sign-on letter that has over 500 signatures to every single member of our congressional delegation. Across the state, Wednesday, Thursday, and Friday, we are going to be doing in-district deliveries of those letters and those storybooks to each of the congressional members, in hopes that we could really be pushing the importance of Medicaid and how any kind of cuts to this life-saving program would be detrimental and catastrophic to not just North Carolinians, but also to our state budget. And I will stop there because we're already at 8 o'clock. But thanks so much for giving me the opportunity to talk about this today.
Thanks, Rebecca. I did see some notes about how daunting and sad this all is. And I do think we are seeing just an onslaught of really challenging cuts. And I do want to make sure that we get to a conversation about what we can do about it. Rebecca, you laid out a few things, but I think it's really important that we hear from Nicole Price with the North Carolina Association of Educators about what supporting public education for every child means in the face of these federal funding cuts that are being proposed to the Department of Education and the potential impacts on our state budget. Nicole, thank you so much for being with us.
Thank you for inviting me. I know we're at the 8 o'clock hour, so I will try to be quick. I'll say a couple of things I think we can agree on. I'll give a couple data points, and then I'll say one thing that we're planning and turn it right back over to you, Alexandra. I think we can all agree that eliminating the Department of Education is not about a building in Washington or rooting out wasteful spending. It's about direct harm to students in our schools right here in our state. I think we can all agree that the RIFs, the letting go of 1,000 plus workers from the Department of Education, which should be happening on March 21st, is also a direct attack on low-income communities, students of color, and the students in most of need. I think we can all agree to that. So I'm not going to go into all the things that we already know about where we stand with education in the state. We know that public education has been underfunded for the last for more than a decade. We already know that we have faced a teacher recruitment and retention problem. We know that we don't have as many people going into public education. Here are a couple of data points. More than 200,000 students receive benefits in the amount of $400 million for individuals with disabilities, IDEA. We know that more than 700,000 students receive benefits in the amount of $500 million in Title I funds that come into our state. Cuts to those programs potentially mean that Asheville City school system would get would take a hit by 2.7 million, Buncombe County 13.4, Guilford 49.1, Wake County 60 million, Charlotte Mecklenburg school system 63 million. So right, like some of these numbers have been out in the media. We know what the dollar impact is. One of the things that doesn't often get talked about is what happens if we actually lose the Department of Education in terms of the civil rights enforcement investigation, issuing guidance on civil rights that apply to LGBTQ plus students of color, students with disabilities. The Associated Press said that the most complaints that come into the Department of Education involved discrimination against students with disabilities. And so parents won't have an enforcement place to go, right? That's one of the things that very rarely gets talked about. That's the thing that we need to make sure that we start uplifting more and more. And one of the things that we will start, one of the things that we're beginning to plan for this past weekend, NCAE had what is called our annual convention, where leaders from across the entire state come in and decide on new business for the organization. And what they voted on just yesterday is a mobilization and action on March 1st, really linking what's happening at the federal level to the impacts that we will see at the state and at the local level, how it will impact our budgets. Given the time, I tried to throw out a couple things really quick. Sorry for rushing through that, but I also want to be respectful of people's time because we're supposed to end at 8 o'clock. So I'm gonna turn it back over to you, Alexandra, and I will take any questions folks have.
Thank you so much, Nicole. And I'm sorry that I didn't do a very good job of pacing us through the hour, but everybody had so much information to share. So much information that I hope you will use in your conversations with neighbors, family members, friends, your community. Make sure that everyone knows what's at stake in these federal funding decisions that are getting made right now. Make sure that they're communicating directly with their elected officials, your elected officials. As we said, these federal funding actions will hurt North Carolina. They'll create a cost shift to the state budget that we can ill afford. they'll hurt people in our communities, and they'll block progress on key goals that we have as a state. Right now, Congress is on recess. As Rebecca said and others mentioned, now is an opportunity to engage directly with your federal delegation, both House members and Senate members, to tell them that we want them to put North Carolina first, not millionaires, not billionaires, but the healthcare, the education, the jobs, the food, the farms, and the housing that every community, every family in our state deserves and should have access to before we cut taxes again for the ultra wealthy. So please take a moment and take action on this. We'll be sending this as a follow-up. We'll also want to be clear that one of the big challenges we face in North Carolina is no state will ever be able to absorb the scale of these federal cuts that are being contemplated. But North Carolina is uniquely in a bad spot. And it's in a bad spot because for over a decade, we have continued to cut taxes for the wealthy and profitable corporations. And our income tax on corporate profits will go to zero after 2030. So we urge you to share that information, sign on to the petition to call on our state legislators to pause the income tax cuts and to make sure we have the funds to minimize the harm that's coming to our communities. I'm so grateful to all of you for joining this evening. I'm happy to stay on for answering any questions. I know folks will need to leave. We'll follow up with slides, ways to stay engaged. We hope you'll take this week as a week of action and join with us in demanding that our elected leaders at the federal and state level put families and communities first, not the ultra wealthy. Thank you so much for your time. I hope you have a great evening. And thank you so much to all of these wonderful panelists who joined and shared their expertise and information with us. Thank you.